Good morning. Today's lecture will be on Introduction to Rehabilitation Medicine. I am Dr. Farisho, Professor and Consultant Rheumatologist. Why rehabilitation medicine is important? Commonly encounter diseases like acute low back pain in the rheumatology department or a neurological deficit like stroke or facial palsy in the neurological department. These are very important and necessitate returning to the previous normal condition. Planning objectives. At the end of this lecture, you should be able to define rehabilitation medicine, physical therapy, occupational therapy, impairment, disability, handicap. Then giving some practical examples, describing rehabilitation team and the program, listing and describing method of rehabilitation of pain and inflammation, summary, and we will finish with a quiz. What's rehabilitation medicine? Rehabilitation medicine is teaching the patient and enhance and restore the functional ability and the quality of life. The first thing important to us is physical therapy. What's physical therapy? Physical therapy is teaching the patient the exercise and the skills of the lower limb to improve joint and muscle function. Second important term is occupational therapy. What's occupational therapy? It's teaching the patient the exercises and the skills of the upper limb to do the basic self-care activities, work and leisure activities. Also, occupational therapists are important to do other activities like washing dishes or doing homework. We have three important terms to be remembered: impairment, disability, handicap. What's impairment? It is loss of anatomy or function. Disability, it is loss of function, limitation of activity. Complication of both impairment and disability will lead to what's called handicap. Now we will have some practical examples on disability. The first one is rheumatoid arthritis. Loss of anatomy lead to knee pain, small flexion contractures. Loss of function lead to activity restriction, inability to walk for long distances. And this subsequently lead to impairment in participation, inability to participate in recreation like golf playing or walking. Another important example is ankylosing spondylitis. Loss of anatomy lead to back pain and stiffness. Loss of function lead to inability and limitation to lift or bend activities. Both of them lead to inability to do medium and heavy jobs and limitation in recreation like bowling. Also, rehabilitation is important in respiratory disease, and this is what's called pulmonary rehabilitation. Also, it's important for patients with prolonged bed rest, especially after severe injury or after surgery. What's this? Obviously, these are a group of peoples, and this is what's called rehabilitation team. This team worked together in the rehabilitation center over weeks to do certain rehabilitation sessions. What are the components of rehabilitation team? The first important component is the physician. The next one is physical therapist, المعالج الفيزيائي. Third one, occupational therapist, المعالج المهني. Then the orthotist, اختصاصي التقويم. Prosthetist, اختصاصي الأطراف الصناعية. Psychologist, اختصاصي الطب النفسي. Social worker, اختصاصي الطب الاجتماعي. Special therapist, اختصاصي الكلام. Audiologist, اختصاصي السمع. Recreational therapist, اختصاصي الاستجمام. And dietitian, اختصاصي التغذية. What's rehabilitation program? For our medical students who attended the rheumatology clinic, outpatient clinic, especially the consultancy, they saw the medical doctor writing a letter, and this letter was called a referral letter to the rehabilitation center, which was either white or yellow. What are the content of this referral letter? Three important parameters: the diagnosis of the patient, goals of therapy, and then treatment with the number of sessions. Where we should do rehabilitation, either as outpatient clinic in the hospital and the patient discharged home, especially like this patient with knee pain, or in the hospital for those who are admitted and necessitate long physiotherapy during hospitalization. What are the goals of physiotherapy? We have two important goals, short-term goals and long-term goals. The short-term goals done to provide immediate achievable target or aim, while the long-term goal is done to be for the patient over several months. How to rehabilitate patient with pain? We have four important domains: education, exercises, physical agents, and assistive devices. Education. What should we educate the patient? At first, you should educate the patient to avoid a predisposing factor. Then, weight reduction, quitting bad habits like smoking or drinking, and eating healthy diet, fresh fruit and vegetables. Exercises. What are the exercises that you should teach the patient to do? We have two types of exercises, limb exercises and the trunk exercises. Limb exercises include range of motion exercises, strengthening exercises, and mobility exercises. Range of motion exercises are either passive, done by the examiner, or active, done by the patient, or active assisted, done by the patient with the help of the examiner, and stretching exercise. The strengthening exercises are done to improve and strengthen the muscles. The mobility exercises like aerobic exercise, as in swimming, walking, and relaxation exercises. The second part of exercise is for trunk exercise, which include breathing exercises, extension and flexion exercises, and finally strengthening and stretching exercises. What are the treatment of pain and inflammation? The techniques used, rehabilitation technique. We have six physical therapists, physical therapy agents: heat therapy, cold therapy or cryotherapy, electrical stimulation, traction, massage, and assistive devices. We need to remember an important point. The best treatment or physiotherapy for patients with acute pain is cold therapy. The best therapy for acute pain is cold therapy. The first physical agent is heat therapy. What is the mechanism of heat therapy? The mechanism of heat therapy is to increase blood flow. This will lead to muscle, make connective tissue more flexible and subsequently decreasing joint pain, stiffness, and muscle spasm. What are the uses of heat therapy? Three important uses: inflammation like arthritis, muscle spasm, injuries like sprains and strains. Sprains is muscle injury, ligament injury, while the strains is injury to the tendon of the muscles. What are the type of heat therapy? We have two types. Heat therapy applied to the body surface, which include first infrared, like in this patient, this lamp called infrared. And the most important point is to avoid burn site. What are the indications and contraindications for heat therapy? The first, the indications include arthralgia, arthritis, back pain, fibromyalgia, muscle spasm, myositis, neuralgia, sprains, strains, tenosynovitis, and whiplash injuries. What are the contraindications? The contraindications are mainly for vital organs like severe heart diseases, liver or kidney disorders, peripheral vascular diseases, or reduced skin sensation, infection, and malignancy. These are examples of the infrared for the upper neck pain, back pain, or neck pain, for the left tenosynovitis of the wrist, for the knee pain, and for the low back pain. The second part is hot packs. Hot packs are cotton cloth containers that filled with silicate gel and usually warmed in a micro oven. With the indications are the same as infrared. These are various examples of hot pack. We have the manual simple hot packs like this one, or we have the electrical type of hot pack like this one. Third one is paraffin bath. We have two techniques: the dipping techniques and dipping in techniques, and the painting with wax technique. And this is done usually for the small joints like the wrist, ankles, or the knees, and should not be used over open wounds. This is the dipping technique for the tennis elbow. This is the painting technique for the tenosynovitis of the hands. And these are both techniques, the dipping and the painting technique. The fourth one is hydrotherapy. What's hydrotherapy? Hydrotherapy is immersion in agitated warm water in a large industrial whirlpool. What's the mechanism? The main mechanism are stimulating the blood flow, helping to clean helping to clean out burns and wounds, and this will lead to relaxation of muscles and relieving the pain and improving the range of motion exercises. These are various types of various examples of hydrotherapy for the neck pain or the back pain and exercise of the muscles in a pool. And this is the similar thing for exercises in a pool. B, heat therapy applied to the deep tissues include first shortwave diathermy, which is produced by electromagnetic. This is the instrument of shortwave diathermy, and it is simple to be applied. The main indications are mechanical pains, pain due to kidney stone or sinusitis, short-term or chronic. These are examples of short-term diathermy for low back pain. And this is also for low back pain, and this is for knee pain, especially knee osteoarthritis. The second type of deep therapy is microwave diathermy, which is produced by microwave, as in this image. It is simpler to be applied and more comfortable than the shortwave diathermy, and evenly warm the deep tissues without heating the skin. These are examples of some types of microwave diathermy tools, and this is applied to the back. Third, ultrasound. Ultrasound is high-frequency sound waves to penetrate deep into the tissues. What are the main uses? The main indications are bone injuries, bursitis, complex regional pain syndrome, contractures, osteoarthritis, and tendinitis. What are the main contraindications? The main contraindications are ischemia, infected areas, healing bones or eyes, brain, spinal cord injury site, ears, heart, or reproductive organs, and tendency to bleed or cancer. These are examples of ultrasound usage. This is ultrasound for right ankle tenosynovitis or tendinitis or ligament sprain, and this is for the knee pain, especially for chondromalacia patelli and for the knee osteoarthritis, and this is for the rotator cuff tendinitis or frozen shoulder, and this is the instrument of the ultrasound. Second, cold therapy or cryotherapy. It is applied over numb tissues. Main indications are muscle spasms, acute low back pain, and acute inflammation. Why? Because it decreases this pain and the spasm, and at the same time decrease the edema. What are the main contraindications? The main contraindications are peripheral vascular diseases. What are the types? We have three important types: ice back, cold back, and fluid type. These are various types of cold therapy. This is the pool, cold therapy pool, and this is the cold pack applied to the shoulder, to the knee, and this is for the back, cryotherapy for the back, low back pain. Third, electrical stimulation. What are the main indications or contraindications? The electrical stimulations is usually used for neurological injury or deficit, so it's used for peripheral nerve injury, spinal cord injury or disorder, or stroke, muscle atrophy, chronic back pain, rheumatoid arthritis, sprained ankles, shingles, or localized area of pain. The main contraindications are heart disorder or pacemaker. Why? Because it can induce arrhythmias, and also over the eyes. These are various examples of using transelectrical nerve stimulation TENS for the left knee, knee osteoarthritis, and this is for the right shoulder, rotator cuff tendinitis, and low back pain for spondylosis, and this is for the knee pain also for chondromalacia or osteoarthritis. This is the instrument tool of TENS, transelectrical nerve stimulation. Fourth one, traction. You should remember an important point in traction. Always, you should never do a traction for elderly people. Why? Because most of them have osteoporosis, and if you do the traction, you will induce for them osteoporotic compressed fracture, spinal cord injury, and complication of the spinal cord injury. The main indication for traction is in young people, and usually with the chronic neck pain, cervical spondylosis, disc prolapse, whiplash injuries, and torticollis. These are various types of traction in the orthopedic department and or in the rehabilitation center. This is for the traction for the leg, back, and for the cervical. Fifth one is massage. What's the mechanism of massage? The massage relieves the pain, reduce the swelling, and also reducing the size of reducing and loosening the contracted tissues. What are the main indications? Main indications are arthritis, bursitis, periarthritis, fibromyalgia, sprain, which is ligament injury, and strains, which is injury to the tendon or muscle, contracted tissues, fractures, joint injuries, hemiplegia, paraplegia, quadriplegia, low back pain, neuritis, and peripheral nerve injuries. These are various types, various uses of massage. Massage commonly done in the rehabilitation centers and usually have good results. This is rehabilitation massage for the neck pain. This is for the thigh spasm. This is for the upper back or neck pain. Also, that this is for the leg. Assistive devices. We have general point you should remember. We have what's called orthosis, and the orthosis in the upper limb called splint, in the cervical called cervical collar, and for the chest called brace, and for the back called corset, for the knee and ankles called orthosis or gaiters. Also, we have another important assistive devices which are prostheses اللي هي المسند الصناعي اللي هي هنسميها الأطراف الصناعية, and we have the wheelchairs. These are various types of orthosis for the knee, for the ankle, for the hand, and these are artificial limbs or prostheses for the lower limb and for the upper limb, and these are the chairs, either manual chairs or electrical chairs. In summary, rehabilitation is an important part to restore the normal function and the quality of patient's life. We also talked on physical therapy and occupational therapy, and we have known that physical therapy is skills, teaching the patient the skills for the lower limb with exercises, while the occupational therapy is teaching the patient the skills of the upper limb to do the activities of daily living. Also, we talked on the rehabilitation team and the program, physical agents, types, heat therapy with its types, superficial and deep, and we told and we said that the superficial include the infrared, hot pack, paraffin, hydrotherapy, while the deep therapy include the diathermy, shortwave, diathermy, microwave diathermy, ultrasound. Then we talked on the cold therapy or cryotherapy, electrical stimulation, tense, traction, massage, and assistive devices. Now we will finish with a quiz. Simple example of this quiz is in the treatment of pain and inflammation. The techniques used include heat therapy, cold therapy, electrical stimulation, all the above. The correct answer is all of the above. Second quiz is hot therapy seems to be more effective than cold therapy for acute pain. True or false? The correct answer is false. The third one, all of the following are examples of heat applied to the body's surface except infrared therapy, hot packs, paraffin bath, shortwave diathermy. The correct answer is shortwave diathermy. And thank you. Any questions will be answered.